More now on the federal government's decision to press pause on the Johnson & Johnson COVID-19 vaccine. It comes as the number of COVID cases continues to surge in some parts of the country.
WGN's Sean Lewis is live at the United Center with more on that. Sean.
Yeah, Lourdes and Ben, we're talking about something very, very rare, 1 in a million occurrence, still serious enough that the FDA and the CDC are putting this pause recommendation on for the Johnson & Johnson vaccine, leaving Illinois and Chicago to make other plans for their vaccine rollout. At the United Center, it is business as usual, at least for the next week. Only the Pfizer vaccine is being administered here.
This is a really rare event if you look at what we know so far.
Dr. Anthony Fauci among the many medical experts today to talk about the concerns, though, over the Johnson & Johnson vaccine. Out of the nearly 7 million J&J doses given so far in the United States, 6 women have experienced cerebral sinus blood clots, a very rare and very serious side effect they believe may be linked to the J&J vaccine.
If you've received the vaccine and developed severe headache, abdominal pain, leg pain, or shortness of breath, you should contact your healthcare provider and seek medical treatment.
In the 6 known cases so far, all are women, and all are between the ages of 18 and 48. None are in the Chicago area. 1 woman has died. Another is in critical condition. The symptoms arising between 6 and 13 days after receiving the J&J one-shot vaccination.
This is an immune response that occurs very, very rarely after some people receive the vaccine, and that immune response leads to activation of the platelets and these extremely rare blood clots.
You know, we learned about this morning like everybody else did.
What it means for Chicago and the surrounding area is that some vaccinations will have to postpone appointments, mostly at 78 smaller clinics and through employer-based initiatives. Walgreens and CVS have paused their J&J vaccinations. In addition, all 5,000 homebound vaccination appointments are postponed temporarily and will be rescheduled. For mass vaccination sites like Chicago State University, the Pfizer vaccine will be used instead of the J&J vaccine beginning Wednesday. What is not clear is what will happen at the FEMA-run United Center site. The J&J vaccine was scheduled to begin here on April 20th.
And we are waiting to hear from FEMA on their intended plans.
Despite the serious nature of this rare potential side effect, federal health leaders continue to encourage vaccinations, especially with the 2-shot Pfizer and Moderna vaccines, developed with different technology than Johnson & Johnson.
I think this is an unusual occurrence of a serious adverse event that you want to make sure before you go forward, you investigate it thoroughly. And that's exactly what they're doing. They're pausing so that they can look at it more carefully.
The big question right now, how long will this pause last on the Johnson & Johnson vaccine? At this point, we still do not know, though the FDA gave some hint of it. There will be an advisory committee looking at this issue tomorrow morning. It could last a couple of days until we have an answer from them. We are live at the United Center. Sean Lewis, WGN News.